George Kosmides at drkosmides.com, home of healthy aging, and creator and developer of the Life Without Diabetes program. Today I'm here to talk about the important distinction between a type 1 diabetic and a type 2 diabetic. And it's pretty huge and very important. Now, the type 2 diabetic or acquired diabetes is something that we get as we progress through life and caused by a number of factors: lifestyle, hormones, and emotions, and basically our day-to-day aspects of our life, from how we deal with emotional aspects as well as the food choices that we pick. And that can precede type 2 diabetes. And that testing is usually done something called an A1C, which is a 3-month average of our blood glucose. And if your doctor sees that on the rise, it should be confirmed within 3 months. So the normal number for that is a benchmark of 6.5 or lower. I like to see 6 consistently for about a year. And that just tells me that the person is following the guidelines, their emotions are controlled, or at least they're handling them, because emotions can play a huge role in blood sugar spikes, as well as fundamental lifestyle changes. Now, type 1 is very different. In type 1 diabetes, there's a genetic disorder inside the pancreas in a small cell called the islets of Langerhans, and there's a genetic disorder. The cell's not functioning properly. So in most cases, synthetic insulin is necessary, but there's a lot a type 1 diabetic can do to reduce the amount of synthetic insulin just by correcting lifestyle, emotions, and so forth. So there are 2 main tests with that. One is called the GAD, the GAD, and then also the A1C, or the 3-month average. Those should be done within, depending on the research that you review, anywhere from 30 to 90 days. Repeat them in order to confirm that diagnosis of a type 1, because it's critically important, because now we're dealing with a genetic disorder where type 2 is a lifestyle disorder. And there's a lot of confusion with people that have been diagnosed with a type 2, but for some reason they say, well, it runs in my family, so it's inevitable, and that couldn't be farther from the truth. So the premise of supporting type 1 and type 2 diabetics is very similar, but we need to understand if there's a genetic origin or there's a lifestyle emotional origin, or both the type 1 and type 2 can have a lifestyle emotional origin that contributes to how effective their care is. So I hope that helps to distinguish between the two, but keep in mind the premise, whether you're on my Life Without Diabetes program, is absolutely similar. You can resolve a type 2 diabetic, and I've had them in my office on my program with blood sugars over 800 and A1Cs, the 3-month average, over 18, resolve that condition, and not only resolve their blood sugar condition, but improve their whole laboratory results, from their cholesterol, their triglycerides, their ratios, their kidney function. At the same time, their blood sugar is resolved. Now, with my type 1s, if defined properly and tested properly, it's a genetic disorder. And there's a lot that can be done from a lifestyle, emotional balancing point of view that can really curtail their drug use, because ultimately, whether you're a type 1 or type 2, it's the medication use that contributes to the complications. Kidney disorder, liver disorder, digestive dysfunction, cardiovascular disease, sleep is another factor. So there are a number of factors that we need to step back and say, okay, what can we begin to do today to begin to take steps in order to, in a type 2, resolve my condition, and in a type 1, to more effectively manage my condition so my body can deal with this genetic disorder. So I hope that was helpful. It's just a basic introduction to the distinctions between a type 1 diabetic, genetic diabetic, and a type 2 acquired diabetic. So thank you for taking your time today to listen to me, and I hope this has been helpful. I'm Dr. George Kosmides from drkosmides.com, home of healthy aging, and creator and developer of the Life Without Diabetes program. Thank you very much. I'll talk to you again soon. Bye-bye.